It is my role as a professional healthcare to teach diabetics to be vigilant enough in taking care of their feet so as to avoid foot ulcers, infections, and amputation. In this video, I give you tips that you should adapt as a diabetic in order to take care of your feet properly so as to avoid foot ulcerations and amputation. Poor foot care and peripheral neuropathy, a condition that is characterized by the numbness, stinging or burning sensation in your ankles and feet, or the loss of sensation, are some of the common factors that have been associated with foot ulcers or foot amputation. So in the tips that I'm going to give you in managing foot ulcers, diet and exercise is a very important factor to consider. Eating right, exercising, regularly monitoring your blood sugar levels, your blood pressure levels, and your lipid profile, and also adherence to your medication is one of the best tips in managing foot ulcers. And why is it so? When everything is within their optimal levels, there will be no damage to the nerves, and enough oxygen or blood is going to be transported to your feet, such that when there's any infection or there's any cut, the cuts will not worsen, or they may not be infected to lead to foot ulceration. It's also wise for diabetics to have regular inspection of their feet. And when you're checking for your feet, that is under the feet, you can use a mirror or a magnifying lens. You will be looking for either cuts. You will also be looking for calluses, ulcerations, any ulceration. You'll also be looking at the maceration in between your digitals. You may also check for any nail discoloration or thickening or loosening. Also check for the skin, your skin discoloration in general. So tip number 2 is to inspect your feet regularly or on a daily basis. It is a rule for all diabetics not to go on barefoot. Wherever you are doing your daily activities, whether in the house, you are in the garden, or you've just gone for a function or a picnic like in the beach, you're always required to wear comfortable shoes that are well padded and fitting. So rule number 1, no barefoot for any diabetic patients. So, and then another thing, when you're putting on your shoes, you're required that you put on with your together with your socks. So the socks should be seamless or comfortable enough so that they are not causing any friction on your feet. Preferably white in color, so that when there is any bleeding, you may notice as easily. Diabetics mostly lose sensation on their feet, or because of their nerve damage, that's the neuropathy, they may lose sensation, so that when something pricks them or cuts them, they may not notice easily, and it may get worse. When bathing, kindly check the temperatures of your water before using it. Try to gauge it. It should not be too hot. Maximally should be like 32 to 36 degrees Celsius, so that you don't get burned. When you're showering, take a few minutes. Do not stay in the shower, or do not soak your feet for too long in the water, such that it may dry out the skin or cause thinning, which may cause new blisters or sores to form. Again, when your blood sugars are not controlled well, such cases may lead to the wounds getting too long to be healed. Make sure you pat your feet dry. Do not rub. Stop the rubbing motion. You're risking to damage the skin and also causing, again, other blisters. Then lotion your feet regularly, upper and below your feet. Avoid rubbing in between. Avoid lotioning in between the toes, such that you're causing too much moisture there, or the damping thing, which may encourage fungal growth. Advise to visit your podiatrist or any emergency center for regular checkup of your feet, so that they check especially for the symptoms of neuropathy, common thing that many diabetics usually cry about. If you have any sprain, for those ones who are highly active, you have got any sprain, or your ankle is twisted, or your hand is injured, or any injuries that is very suspicious, kindly run to the or call your any emergency healthcare for them to see what is wrong and check for anything. And we need you to lead a healthy lifestyle. We need you to have a quality life with no aches or no injuries. I leave it at that. Let's meet on another episode of diabetes, where I want to focus on symptoms of diabetes to watch out when you're there at home. So thank you again for the new subscribers, and for those ones who are coming back, I really appreciate that. Bye bye.